This morning news is brought to you by Regence Blue Cross Blue Shield.
Joining us live in studio is Dr. Mark Hiatt, Executive Medical Director of Regence Blue Cross Blue Shield of Utah. It's always good to see you, Dr. Hiatt. I want to talk a little bit about high cholesterol. Is it true that fewer Americans have higher cholesterol?
It is true. According to a recent survey conducted by the Centers for Disease Control and Prevention, the prevalence of adults in this country with high cholesterol has declined significantly over the past 15 years or so.
Wow.
From about 18% of adults to 12% currently.
So when we say high, what are we talking about? How high is high?
Well, high cholesterol is defined in this survey as above 240.
Okay. All right.
Is there any indication as to why that's going down? Is that, are we actually exercising or eating better, or is there no
Maybe,
indication
right?
of what that
I think it's a combination of things, Amanda. I think it is due to our exercise and dietary habits, which are improving. I think a large portion may be due to the fact that we're taking statins more, which are those blood cholesterol lowering medicines.
Okay. Hey, we're talking, of course, eating and diets and things like that. And tomorrow happens to be Halloween, when everybody's going to go out with their kids.
I worry about this.
And we're all going to load up on sugar.
I think my kids are addicted to sugar.
Really?
I worry about that.
Probably a lot of kids that are. Are there any guidelines, though, Doctor, about added sugar in our children's diets?
There are. From the American Heart Association, there are these guidelines for what the appropriate amount of added sugar in our diets each day should be. And the numbers are low. We're talking about 4 teaspoons for children under 8 teaspoons for preteens and teenagers, and just 9 teaspoons for adults.
So how many candies is that? How many candies can I let them have? Now, I'm probably going to break the rule tomorrow, but in general.
Well, in general, the good measure I use is 1 can of soda is about 8 teaspoons of sugar.
Oh, my goodness.
And so if you've had one this morning, you've already surpassed your limit. You're done.
That's
All right.
it. That's it for sugar for the day.
I want to quickly ask you about this because we've been talking so much about opioids. Narcan is available at Walgreens.
That's true. At its 8,000 pharmacies across the country, you can actually get Narcan, which is naloxone, at Walgreens. It's also available at CVS in about 43 states.
How do you administer this?
Well, Narcan is, of course, the medicine used to reverse the negative effects of
the
an opioid overdose. And you can administer it in a number of ways. It's available by shot, such that you can inject it into a muscle, or as a nasal spray, such that you can apply it to the nose of a person who is overdosed.
Oh, wow. Almost like a flu mist kind of a thing.
Good information. As always, Doctor, thank you. This portion of Utah's Morning News brought to you by Regence Blue Cross Blue Shield.